you. Baltimore City Council Ways and Means Committee, we're back for City Council Ordinance 22-0235, Ordinance of Estimates for the fiscal year ending June 30, 2023. I'm Eric Costello, Councilman from the 11th District, Chair of the committee. Joining me to my left, Vice Chairman of the committee, Councilman Robert Stokes, 12th District. To my right, Councilwoman Odette Ramos, 14th District, Councilwoman Felicia Porter, 10th District. On behalf of Mayor Brandon Scott, we have Nina Themelis and Natasha Mehew. On behalf of Council President Nick Mosby, we have Nate Poole. Staff to the committee to my immediate right is Marguerite Curran. Director, how many slides do you have?
We have 5. Can you hear me?
Yep, I'm going to get to the mic in 1 second. Yep, you have 5 slides. I'm going to ask you to limit your presentation to no longer than 10 minutes. Give me 1 second. When you are speaking, please speak directly into the mic, 1 hand length away. You are inevitably going to screw up, just as every agency has, and I will politely remind you to please speak into the mic. The reason for that is folks that are listening from home, as well as the recording of this hearing. Mr. Wells, you can feel free to take your mask off when you're speaking or elsewise. With that, I'm going to ask you to take it away, introduce your staff, and get started on your presentation, then we will jump into questions.
So just hold it like this. I don't want to be the, mess up on the first time. So good morning, City Council members. Thank you so much for having us here. I am Irene Augustin, Director in the Mayor's Office of Homeless Services. I'm joined here today by my deputy, William Wells. He is the Deputy Director of the Mayor's Office of Homeless Services. So I'm going to get right into our budget presentation. Just a little background for people that may not know this. The mission of the Mayor's Office of Homeless Services is to make homelessness rare, brief, and one time. MOHS became a standalone agency in fiscal year 2020 when the Mayor's Office of Human Services was split to form MOHS and the Mayor's Office of Children and Family Success. In June 2021, MOHS hired a new director and deputy director. That's me and William Wells. And we've just crossed over our 1-year anniversary, June 1st. MOHS administers the federal, state, and local funding that is awarded to the City of Baltimore to address homelessness. The agency contracts with more than 50 local service providers to provide critical services within the homelessness response system. These services include outreach, emergency shelter, transitional and permanent housing to individuals at risk or experiencing homelessness. MOHS coordinates the city's application for federal continuum of care funding and manages all reporting and monitoring requirements for over 150 projects. The agency's homelessness management information system compiles data on services provided and supports over 300 users and is used to monitor program and system outcomes for FY22 budget or FY23 budget for administration services. And in terms of our admin itself, it is about $7.7 million. Like I said, it supports really being able to handle what is federally required of us through our continuum of care funding. I also want to note that there is a position there that is funded through casino funds. And it was funded by casino funds and transferred over to general funds for that. So moving on to the next slide. You want to handle this? Okay. So the next slide, which is service number 893, homelessness prevention and support services for the homeless. It is $524,000. The service includes financial assistance, housing relocation case management, financial counseling, and other direct services for households at imminent risk of eviction. Services include housing relocation, which we've contracted with United Way, and other direct services for youth and victims of domestic violence. This is not reflected in the performance measures. We are in the process of working with our community to really focus on aligning our systems performance measures with our performance measures within our budget. Up there, I think it reflects in terms of number of clients enrolled in homelessness prevention services. There is a target, I believe, of 2,500 and 2,000 for 22 and 23. We are adjusting those so it reflects more of the services that we provide in that, and we'll adjust it to 750 for both years. The reason why we've lowered it, a lot of the eviction prevention funding went to MOCFS, and so we'll continue to partner with them to ensure that people that are at risk of homelessness do get served by those funds. But we also, through our ARPA funding, will have some flexible funding. So if we can divert someone from entering the shelter, which have more immediate needs, we're able to do that. And so we're working with the Office of Recovery Programs to get that project in place. So 750 we feel is a good target, but as we get these programs in place, we'll be monitoring that and making the appropriate adjustments to it. Okay, next slide. Service number 894, outreach to homeless individuals. This supports our outreach services, which includes providing people experiencing homelessness with assistance with their basic needs, connections to housing, case management, any medical or substance abuse treatment referrals, job readiness, and employment service and other community services. Our outreach is largely funded through ESG funding, but is a really important piece of our homelessness response system. You'll see that our actual target shot up to about 7,400 engagements, and that had to do with our response to COVID-19. CDC recommended that people that were unsheltered and unwilling to go into the shelter or the hotels, that they do remain in place. So we stepped up our outreach efforts to be able to ensure that people had PPE, that they had access to water, that we connected them to services. So you'll see that engagement shoot up. The target area will shoot back down again, and we're more focused on being able to connect people from the street directly into housing. We are practicing case conferencing and being able to ensure that that as we engage with individuals, that we're able to also engage them and discuss with them their housing needs and get them connected to housing so they're off the street. Next slide.
That's it?
No, one more.
Oh, sorry.
Or two more. Sorry.
Take your time. I just, the pause, I thought you were.
Sure. I was just waiting for the slide to move. Temporary housing for the homeless, which is service number 895. This supports our emergency shelter system. The budget is $21 million. The city funds 9 total shelters. This budget includes unallocated grant funding in anticipation of additional federal support, which will actually be winding down this year. And so, as you know, our emergency shelter system has gone through a number of transitions over the years. We set up 5 hotels during COVID so that we could decompress congregate shelters. We are in the midst of a transition. As many of you know, looking for replacements for Green Spring and for Pinder Hughes, and looking at non-congregate shelter to be able to do that. In order for us to get there, we demobilized the 2 county hotels. We shifted the operation at Green Spring to the Holiday Inn Express and reopened Weinberg Housing Resource Center at 1/3 of the capacity. And so we are going to be actively working this year to set up those 2 non-congregate shelter spots so that we have permanent facilities for Green Spring and Pender Hughes. And then the last slide, if we get there, is permanent housing for the homeless, which is service number 896. The total budget is $37.2 million. We administer community-based programs that provide medium to long-term housing assistance and supportive services. Funding includes federal grants for the Continuum of Care and Youth Homelessness Demonstration Project. Housing programs include permanent supportive housing, rapid rehousing, and housing opportunities for people with AIDS, which is also called HOPRA. These are all federal funds that supports our ability to keep people housed and is an important part of our homelessness response system. And that is it in terms of covering our slides. Do you have any questions?
As a matter of fact, we do. Thank you so much. Director Augustin and Deputy, we've also been joined by Council Vice President Sharon Green Middleton, 6th District, member of the committee.
Thank you, Mr. Chair.
Thank you. Director Augustin and Deputy Director Wells, I just have 2 comments. First, I want to thank you both for the excellent rate of responsiveness to concerns that I bring to your attention, and also want to publicly thank and highlight the work that Nick Usher and the Downtown Partnerships Homeless Services Outreach Team are doing every single day. I could not be more pleased with the fact that their team, and I know you have a number of different folks under contract, but I could not be more pleased that the Downtown Partnership, that caliber of team has been assigned to handle these services in the 11th Council District. So I deeply appreciate that. I appreciate all the times that you have come out to do site visits with me, meet with community members, and every time that I do bring concerns to your attention, you are responsive. The second comment that I have is I remain deeply concerned about the city's policy around encampments, and specifically the current conditions on the MLK Junior Boulevard corridor. The situation remains untenable. I had a conversation with Deputy Mayor Leach earlier this morning, and I understand that there may be additional guidance coming out from the federal government, and I do sincerely hope that we take the issuance of new guidance from the federal government as an opportunity to first and foremost ensure that we are providing adequate services to our neighbors that are experiencing homelessness, but also taking into consideration the impact that these encampments have on the surrounding and adjacent communities. We have communities that have an expectation that there will not be the quality of life impacts that come along with a homeless encampment impacting their quality of life. So I do certainly hope that that will be taken into consideration, and I'm very confident that with your leadership and Deputy Director Wells' leadership, that the appropriate balance will be struck. So you're welcome to comment. No response necessary. Happy to move on to the next person.
Sure, and I'm going to take a few minutes to comment on that because I think it's important that I share that Baltimore does it the right way. You know, if individuals, and we've seen this in other cities, are forcibly removed, criminalized, it makes it very hard to house them, and they'll just come back. And so I am not sure what the USICH guidance is going to look like. I heard it's going to come out in a couple of weeks. But I know that both USICH and HUD are huge proponents of housing first and getting individuals into housing. They've increased in this, and we've seen a lot through COVID-19, how important housing is, and have increased resources. And my goal as director at MOHS is to maximize every single dollar and get every person into housing. And that's really what's going to end the encampments. And so while our budget, and we're talking about that today, is important, we do have an influx of federal support and federal funding to be able to house as many people as possible. The case conferencing that we're doing with the outreach teams is going to be vitally important. It's also going to be vitally important that we bring our partners in the medical and behavioral health field closer to this issue, so that when we get someone to housing, that they have the right support services around them. And so we are actively working to make sure that we're able to have those resources as we address the unsheltered and encampments within our community. Honestly, that the level of investment that we have right now wasn't seen before this. And so I think that's the important thing to stress, is that when you underfund things or you're avoiding things, that those things go to the wayside, and unfortunately encampments do pop up. And so it's our time to take this opportunity. I think Baltimore, certainly, we're heading in the right direction, and it's working together and making sure that people that are in an encampment, that we get them housed and wrap the right services around them, and we will see a difference in terms of our numbers of unsheltered on the street.
I appreciate all of that. I want to be clear in no uncertain terms, because you used a word that I did not use, and that's criminalizing. And I want to make sure that you fully understand that I am not suggesting criminalizing. And can you confirm that you understand?
Yes, I confirm. I'm just saying it's a warning to us as a community that we don't want to head in that direction.
I understand with that, and I agree with that approach 100%. That being said, there is a significant influx of federal dollars to support the amazing work that you and your team are doing every single day. That funding is made available by virtue of appropriation by this city council. And I also want to comment on the fact that while there is a long-term strategy that is in play, and I believe that you have employed the correct long-term strategy, a common theme this week, and you are going to hear it in excruciating detail this evening and tomorrow evening when we deliberate the budgets of our public safety agencies, is that we have an ability in Baltimore to walk, talk, and chew gum at the same time, which in my mind, and I use that as a metaphor for a long-term, a medium-term, and a short-term approach that all have to be employed at the same time with the same sense of urgency. And I do believe that again, I want to repeat, the long-term strategy that your office, under the two of your leadership, that has been put in place is the correct strategy. But there are short-term issues that must be addressed, and those cannot go unaddressed. And I'm not suggesting that they are, but I'm making clear for the record, those cannot go unaddressed at the expense of existing residents in their community. So I want to make sure that we think about and always keep it in the back of our mind that we have to maintain an appropriate balance while prioritizing the health and safety, first and foremost, of our neighbors that are experiencing homelessness. But we cannot and shall not lose sight of the impact of encampments on the quality of life of residents and adjacent communities. Does that make sense? And
it makes sense, and I would say that my office understands the sense of urgency in general.
I appreciate that.
And we do it from the client perspective of if someone's homeless on the street and they're waiting for us to make decisions or to enact things, we could prolong homelessness. I just want to make sure that as we look at, and we always look at the short-term, medium-term, and long-term strategies, that if we're looking at a short-term strategy, that we're looking at it from all angles and we don't make the situation worse. Because it can be more difficult to house people, which actually makes it more difficult to close encampments. And so we're looking at it from every single aspect. There is a sense of urgency. That's how I operate. And the way I look at decisions is if I'm stalling on something or we're not responsive to something, am I prolonging someone's homelessness? And that's what we're working with the rest of our community to do as well. And so we understand the sense of urgency. We also have an opportunity with the federal funds that we have. And in my career, and I've been working in human and homeless services for 20 years, we've never seen anything like this. And we'll get those injections of funding, and then we won't see them again. And so my goal is to house as many people as we can. We are looking at unsheltered and sheltered at the same time, so we can walk, talk, and chew gum. And I would say that my office is very good at that. We've been doing it since COVID came out, and doing more than I think a lot of my staff have done. Running shelters is one of those things, and so my staff understands the sense of urgency in terms of this. And despite how tired they are, because they've been, running full force since COVID, and I want to recognize them for the work that they do, because I know they don't get recognized a lot in this. We are all committed and hands-on to see this happen.
To me, it sounds like we're saying the same thing and just using different words, so I definitely appreciate it. Is that your interpretation?
Yes.
Excellent. Thank you so much, Director. Vice Chairman Stokes.
Well, I actually echo my colleagues, and I know how tough that is, because I'm sure all my colleagues that are here and not here, we have to deal with those issues ourselves, and a lot of times the public don't understand the process in terms of, I know you have to engage them, but it's becoming an issue in terms of, it's almost like community and some of the business feel like, I know how hard Mayor's Office of Homeless Services work. I know that for a fact. But a lot of times you have community business that feel like that nothing's being done. So I know, again, it's a tough situation to be in. And I like to see if we can work on it a little bit more, so how we can not, I ain't talking about arresting nobody. Please, we know that, and that's something I distinctly say we will not do in this city. But it's just becoming an issue with our business community and our residents. So I think sometimes we have to rethink how we do things and do them a little different, to address them a little different. So I just wanted to kind of follow it up with my colleague. Thank you, Mr. Chair.
Thank you. Council Vice President Middleton.
I first of all want to thank you both for the work that you do, and with your team and with the office. And you're right, we're outreach workers, they don't get enough kudos, and so I thank them as well. My first question, is there a shortage in outreach workers? Do you need more? Is the ARPA money going to help with that as well?
So in terms of outreach, we use some of the CARES Act to fund outreach workers. Our focus is now on coordination. We want to make sure that we're hitting all of the city limits, making sure we know who is unsheltered in each section, so that we can do our case conferencing and figure out what housing and what services individuals need. We've been working with Built for Zero to help us to craft this strategy. And really it comes down to numbers. I think our point in time count this year counted 124 unsheltered individuals, which is down from previous years. Mm-hmm. And so it is, I know when—
Director, I'm sorry, you said 124?
unsheltered in the point in time count, which is a snapshot of our,
That's grossly
Yeah.
down.
well, and we also moved a lot of people into hotels and into shelter.
Okay.
So, I can tell you what the numbers we're looking at in front of us. It is down. Point in time count is a snapshot that we provide to HUD. However, the case conferencing, as we look at who's actively in our community at any given time, our outreach teams will know that. We also need to know where they are in their housing journey so that we can best help them. And so it really falls on coordination. And when Councilman Stokes said we need to do things different, that's the difference that we're bringing to this. Like if you come, whether it's 124 or 200, you need to know who's homeless, and we need to know how do we connect them to services. And that's what we're bringing to this community, is that higher level of coordination. But at the end of the day, it's going to come down to housing as well. We have housing assistance, rental assistance, but we need safe, permanent housing for individuals. So it's much more than just MOHS, and the partnerships that we have with DHCD, with BHSB, with all our partners, all fall into this. So it's more than just MOHS, it's bringing all those partners to the table so that we can connect people to housing and have the right support services.
And I noticed, and they're not just downtown on MLK. I think I've learned so much from the Green Spring homeless shelter facility and just homeless all together. It's we have homeless encampments around our trails. There's a homeless guy in the park, in the Rec and Parks ground still of Green Spring, that people kind of leave alone, but they don't want him there. It's how do you deal with people that just refuse to go into a building or get help to be in a covered place with, running water and so on? There's some people that want to stay and live in a camp, in a tent.
I would say the people that actually want to live in a tent is a very small percentage. The unfortunate thing is when they finally got brave enough to ask for help, it probably wasn't easy to access the help, or they were told no. And I would say that a lot of people that would rather be alone in an encampment probably had doors shut in their face, or people yell at them, or got confused by the system. And so that's why the work that we're doing at MOHS, working at a higher level of coordination and organization, is important to our homelessness response system. If we as practitioners don't understand how to get someone help, there's a problem with the system. And so that's what we're aiming to fix as we're trying to get people housed as quickly as possible. So for the gentleman you're talking about, it's continual engagement, it's building that trust. And I would say all our outreach teams do a really good job, but then now we gotta connect them to housing. And it's that housing stock that becomes somewhat hard to come by. We're getting the rental assistance down, and this is the time to get people housed, is because that rental assistance is there. But if we don't have safe, affordable housing to connect them to, it makes it very difficult to get them there.
Thank you for that clarity. And just lastly, you and Bill, you're always very responsive. If we have questions, you're right there. So thank you. Appreciate your continued work, and hope that the extra ARPA money can really help move your office even further.
Yeah, and I just want to clarify on the point in time numbers. 124 is just unsheltered. There's about 2,000 people that we've counted through the point in time count, because we count sheltered and unsheltered. And so we've seen a dip over 4 years. We're working on our analysis and getting our infographic set up, which we should have very soon, to cover our most recent numbers. But I just want to make sure that's clear between the two numbers.
Thank you, thank you. You're another service that is definitely needed in our city. Appreciate you. Thanks. Thank you, Mr. Chair.
Thank you. We've also been joined by Councilman James Torrance from the 7th District. We'll go to Councilwoman Porter, Councilwoman Ramos, and then Councilman Torrance.
Thank you very much, Mr. Chair. Director Augustine, I had another quick question related to some of the short-term strategies that Councilman Costello mentioned. As you are aware, we've been dealing with a lot of those short-term kind of public safety, public health issues on that MLK corridor in my communities near Washington Boulevard. And one of the main concerns that they have brought up, is, the encampments actually existing on the medians in the right-of-way. So not only is that not safe for them to be there, in the right-of-way, a car can jump that median and kill them. Has your office thought about that, or what are some strategies that we can kind of safely move them into areas that are safe for them and humane for them?
Sure. And I also want to make sure that you understand this is a citywide approach that we have to take when it comes to encampments and public safety. Our office really is we're at every single meeting and we're there and we hear the concerns. But first and foremost, our work is to get individuals into housing. In terms of the safety aspect, we've reached out to the mayor's office. The mayor's office has created really a meeting. MOHS is part of this, but multiple departments, including DOT, Parks and Recs, are really focused at looking at encampments and creating an overall strategy for the city. We will always step up our housing efforts, but it really requires the city coming together when it comes to safety. That is, I lean on my partners that at DOT or public safety to be able to ensure that we're doing this in the most safe way. But we want to make sure from our office that we're working with the individuals, that they're connected to housing and services, and will be a part of any citywide planning regarding this, which I know is going on right now.
Thank you. No, I appreciate that, and I did not mean to highlight your agency specifically, but given the mission and purpose of your agency, making sure that you kind of lead the charge with ensuring that these individuals are safely housed in the short term, intermediate, and long term. I'm looking to you all to kind of like coordinate those efforts because and I understand it's a citywide issue. However, when we're talking about an agency-specific approach, I expect you all as the agency representing those experiencing homelessness to coordinate those efforts, to lead those efforts, so that we can get some sort of response. Because as of right now, there hasn't been much traction on those short-term and intermediate issues that the councilman and I are discussing. And from what I'm understanding, just by that response, while it's happening, that really wasn't an answer about what specifically benchmarks are being performed by the agency to mitigate this very serious public safety, public health issue for these persons experiencing homelessness.
I mean, we lead the effort when we're getting someone into housing or trying to figure out the situation. We're the ones communicating with the clients. In an overall strategy, when it comes to medians, that's, like I said, we don't lead the median discussion because that's a different department, but we are involved and will be a part of whatever strategy.
Director, let me pause you. Which department is that?
I believe it's DOT that handles the medians.
So, Deputy Mayor, this is part of some of the challenges and frustration we've been experiencing all week on the council, is that there's a clear concern, like you and I have discussed, on behalf of Councilwoman Porter and I and the communities we represent around the MLK Boulevard corridor. And the response is, well, it's a different department. Someone's got to be responsible. And what I'm hearing you say, Director, is it's you that's responsible for coordinating that effort with DOT, but there's an issue, right? In this case, it's individuals experiencing homelessness and being in the median. That's the issue. There's got to be a lead agency for it. It's not three agencies that they get to their part of it when they get to it. Mm-hmm. So I guess
Yeah, and so I'm sorry, Mr. Chair, to interrupt, but more importantly, this requires a coordinated effort, and Deputy Deputy Director Leach, excuse me, Deputy Mayor Leach, we've been talking about this, for at least 6 to 9 months now. And, there are a lot of other, issues that I won't bring to the forefront, but something that really requires a coordinated effort in the immediate term is really rehousing these individuals. And I know that it's a behavioral, it's behavioral. I know that it's, some people feel comfortable living out of doors. I understand that. But in a sense, we still have to provide a humane effort for these individuals so that they are still safe as well. And so I just want to put that out there. I'd like to actually ask that as a formal request, Mr. Chair, for short-term and intermediate solutions from this homeless plan. I believe we've been working on this for a little while now, and I'd like to see some results.
Absolutely, Councilwoman. Can you please define short-term?
Yeah, short term. Yeah,
What your
within,
expectations
short term.
are.
Yeah, short term. Thank you, Councilwoman. So short term, I'm requesting something within at least a month that we can look to these medians to rehome some of these people from these medians, because it really is a safety issue. Long term, I'm looking for how we can expand and really get these people to rehome safely. We've been talking about this for a number of months now. Yeah, gateways, thank you.
Yes. Thank you for that question for both Chairman Costello and then
Take off if you want.
oh, sorry.
You don't have to. You can if
No
you
worries, no worries. So to address the point specifically around MLK and some of the individuals that are experiencing unhoused homelessness, and the director and her team can speak more to the case conferencing piece of the work. So we do have a strategy where we are, as we identify housing units, that we are working through kind of our list of individuals to get them connected to housing. We have started that the case counseling for those individuals who are in encampments, if you will. So we've already been working on those who are in our hotels and those others that are in shelter. And so now we're starting that process for those who are currently in encampments, and the director and her team can talk more about it. I do want to kind of elevate the conversation and talk a little bit more about some of the quality of life issues that we see around these encampments, which you and I have been working on all of those issues. And so what we've been able to do, I would say, over the past few months, and I did just see your email around the biohazardous waste removal and all of that. As we started to, yes, as we started to dig deep into some of these issues, it is an issue of coordination, right? So we identified that there is not an agency who does biohazardous waste removal. And so through our regular convenings with all of our partners, we've been able to identify strategies to start to address some of those issues. So we've talked about bringing on a contractor, since DPW, DOT, and none of our agencies support that work. So we are doing that coordination at the mayor's office level, and of course working closely with the mayor's office of homeless services. And as you continue to raise the specific issues, which I know your community continues to raise those issues, we want to be responsive to those issues. I do think that it is the broader concern is around the safety of the medians and how we can transition individuals out of those medians into safe housing. And so I want the team to talk a little bit more about the case conferencing process, which will hopefully make an impact on those individuals who are in encampments along that median.
Okay, and so Deputy Mayor, is that a confirmation that we'll see immediate results in relation to that median within a said time period?
So I can't guarantee that we'll see immediate results. So a part of the process is that we have to gain the trust of the individuals who are encamped along those medians, and they have to be willing to accept the services. And so that's where our outreach team comes in play and all of the work that the director mentioned. So we're going to continue to work with the individuals there, provide them housing as it becomes available, make sure that they have all the required documents. So it is a bit of a process that I do want the director and her team to kind of talk through the process that it will take. But as units become available, we are working with those folks who are living in encampments to try to get them placements into housing.
Before we go to the director, what's the breaking point whereby we kind of just say, okay, we have to do something now, and we have to do something immediate?
Yep. So what I will say is in the guidance that we've been working on, our FAQ document, which we hopefully will release soon, one of the things that we talked about is kind of this breaking point and when do we demobilize an encampment. Yes. And so what we have decided, based on the guidance that has been provided to us and best practices across the country, is it's a couple of things. So it is when there is a health or safety risk. And so we're talking about things like fire, which we have seen in our encampments. Yep. If there is disease, for example, that's located in encampments, right? So there are very specific things that we've been talking with BPD, fire, the health department about what would be those indicators where we should immediately demobilize an encampment.
Do you have an idea when those indicators will be ready to kind of discuss more? Because, one of the long-term strategies that I'm thinking about is actually, you mentioned, I've been tracking the USICH guidance. I'm really excited that they're coming out. And so my goal is to actually have an informational hearing to discuss that guidance and how that formulates into the strategy that you are developing. And I assume that the criteria that you're mentioning is going to be explicitly stated. So,
yes.
And I only bring that up is because I understand kind of, it's a push and pull. We are here to represent our constituents, and like you said, they bring these issues to us. We experience these issues as we live in our communities. I live in the Pigtown area, so I see it every single day. I see, the human waste in the neighborhoods. I see the needles. I see, the food that's left by communities that want to help, but unfortunately don't pick up after, and so that provides a sanitation issue. And so as a public health scientist, I am looking at this from a very holistic perspective, but understanding government, I understand that there has to be some sort of breaking point whereby we are acting on the betterment of individuals, because we are acting on the betterment of individuals, making sure that they have the autonomy to make the decision, but also ensuring that on the broader scale of sanitation, public health, of safety, that we have some sort of mechanism in place where we're protecting everybody. Okay. Mm-hmm. All right, so I'll just leave it there. I won't say too much more about that, and so just look out for that. And at that informational hearing, I'll be looking, specifically asking and looking for those results as we move forward. My second question actually has to do. Excuse me, I need a breath. Whew, I'm preaching. My second question actually has to do with how we're when we're talking about housing in Baltimore City, we know the issue. We don't have enough affordable housing in Baltimore City. Have you all been looking at the tiny homes community to kind of address some of these issues where we are, creating some of those short-term housing options in an economical and safe manner?
So as part of our strategic investment plan, we have the Leadership Committee on Homelessness and Housing that, in general, we're looking at increasing the housing pipeline within our community. I am all for tiny homes if it's what makes up the housing stock within our community. I've seen tiny home projects where it's just homeless, and honestly, if tiny homes adds to the diversity of housing stock within our community and, people want to live in it, I'm all for it. Having it specifically for people experiencing homelessness, I really am on the fence about that. Yeah. But I'm in support of tiny homes. I want one myself. So I think they're really cool. But we will be looking at a diversity of projects. At the end of the day, that's what Baltimore needs, is more affordable housing, a mixture of different kinds of housing, and to really work with the community to be able to do that. The other part of our ARPA request was to increase housing navigation and landlord recruitment. And I think there's some opportunity there with some of our existing landlords, and also setting up a landlord incentive fund to be able, there's probably some properties out there that are, just need a few repairs and can meet the habitability standards. And that's a great way to support really small businesses and landlords within our community, and also help us to reduce and end homelessness. And so those are strategies that we're looking at MOHS and working with our partner at DHCD and our nonprofit partners in terms of increasing within our community.
Thank you. I appreciate that. And you hit on just a special topic for me about the non-traditional definition of homelessness. So I'm glad that you're working with housing. I'm glad that you're working with other philanthropic partners, because elevating this conversation, homelessness is not just living in the out of doors. It's couch surfing. It's ensuring that families, if they become without a house, they're living in their cars. Like, those are some of the definitions of homelessness that we are actively seeing in our communities. That that 2,000 number that you just named, I would garner that it's much more higher than that as well.
Yeah, and I would say that also part of our ARPA request is funds for flexible use.
Yes.
Because not everyone's going to need the intense intervention of permanent supportive housing. A majority of people don't. It's how do we get them back on their feet as quickly as possible so they don't ever have to go to the shelter or live on the street again. And that's what we're bringing to Baltimore, but it does require flexibility. It requires us to do different things. And this is definitely, for our community and a lot of communities across the nation, different. We're used to saying, okay, that's their program, follow that process. The way we want to approach it is, here's the person in front of us. How do we best help that person? Sometimes it just requires maybe like a month of groceries. I don't know. It depends on the individual. And so we will be increasing diversion training, and we will be going out to other sectors for that training as well, because if there's ways to prevent someone from entering into the shelter system, they could show up at a hospital. Mm-hmm. Can they do diversion, upon discharge there? Or, someone identifies at the school. Let's figure out what their natural resources are, and figure out ways that maybe they just need a little bit of help, and we just need to be able to be flexible enough to provide that access. And I would say the same thing goes for people that are unsheltered on the street. Mm-hmm. It's meeting them where they're at, but we have to do a much better job of coordination and getting individuals housed. And it happens. We worked on a couple, and we were able to help get them housed, but it is a lot of coordination to be able to do that, and we'll be there to help that along with our partners.
Thank you, Mr. Chair.
Thank you. Councilwoman Ramos.
Thank you, Mr. Chair. Good morning. Again, thanks for all you're doing. I want to say I understand the concerns that my colleagues are bringing up, particularly around the medians. I do want to say that I 110% support the work that you're doing and the not totally getting rid of every encampment right now, because, as you said, it would just be harder to get them into. And I speak from my district where I have, again, I think the median thing is super important. That is a health and safety issue. I have several encampments in my district in the park, and in Wyman Park in specific. One of the things that we've been able to talk to our residents about is what the policy is, why it's important, and people feel a little bit better about it, and understand that we want to get folks housed. So I try to have those dialogues so that we can. I do have one particular constituent who's totally unreasonable, but that's the way it is. So I had a question. Just all that said, you mentioned you're right. And my colleague said it also, we don't have enough affordable and permanent supportive housing. You're getting ARPA funds to be able to do some capital work as well, to be able to provide that. I also know that some of your landlord fund, isn't it we're going to pay for upfront rent for some folks because their credit is totally out of whack. And we eliminated source of income discrimination, but we did not eliminate credit discrimination. And so can you talk a little bit more specifically about, and just knowing also that we can't just rely on MOHS to build the housing, and it doesn't work that way. And, right, we have to have partners. I want to encourage the hospitals to continue their investment in permanent supportive housing, because then, you know, there's a lot of it. This is also a health issue in terms of not seeing the same people in the emergency room, et cetera. So can you talk a little bit about, and we've had extensive conversations in the ECD committee about this, so we may have to do this separately, but specifically, you know, the goal in terms of the number of units that you want to have, and specifically how we're getting there.
Sure. So through House America that Mayor Scott signed up for, we set the goal for this year to have 1,600 units identified in the housing pipeline. It doesn't mean they get billed this calendar year, because that would, I mean, it would be really cool, but impossible to be able to do that. But we realize, and you know, I'm very excited to work with Commissioner Kennedy on this. I think we're going to be great partners in this. But that really is to kick off, you know, our ability to add more affordable units within our community. 1,600 is not going to be enough.
No, of course, but the 1,600 is specifically for this population.
Yes.
Okay.
And you need, and honestly, you need to have targeted housing to be able to reduce and end homelessness.
Right.
And so I think, because if you have just general housing, you know, it's harder because they're in competition with everyone else.
Right.
And so it makes it harder for us to house individuals if we don't have a dedicated source. I think at one point it's going to flip as we get to understand our inflow and outflow in our system, to where, you know, we just need it to be known that we have to add affordable housing to our community, because housing choice is something that we want to increase out there. So if someone moves into maybe a SRO, because that's what was available and what they needed at the time, and they're like, I think I can move into a 1-bedroom now. Like, there needs to be choices out there for them to be able to move on. And so affordable housing is very important in our effort to end homelessness, but it's also very important to this community, because we need those options just in general.
Right.
To have safe, affordable housing.
Right, and I think the 1,600 number gets to, you know, the larger number, at least for that first step. And this is the 1,600, just to be super clear. It's not hotels, it's not shelter, it's actually units where people have a kitchen, a bathroom, you know, entrance on their own, all of that. So that, I mean, because there's a difference, because some people are like, well, we can just stay in a hotel. I had a constituent that I had to deal with in
I'm
that,
a big
but-
proponent, you know, think of what you want in your home.
Right.
If you're a single person, you want your own kitchen, you want your own bathroom, you want everything to work, you don't want mold.
Right.
And that to me is important in terms of the housing and the partnerships we create. I've seen great permanent supportive housing units done very affordably and done very well. And I think we have a lot of great partners in Baltimore to be able to produce that within our community.
Right. Oh, I'm sure of it. And, you know, our hotel partners had invested in 200 permanent supportive, hospital partners had, you know, participated in, 200, producing 200 units. And so if we can get those partnerships, you know, rolling, that would be,
Yeah,
that
and
would
you're
be great.
talking about our ACES program,
Right.
which we were able to partner with our hospital system and the housing authority. The housing authority and some of our rapid rehousing resources were able to provide the housing, and then the hospitals put in the local match for the support services, which our hope is the state makes that a Medicaid billable activity, which in essence would improve the support services overall within our
Right.
community.
Okay, great. And then my second question, and I know we're running out of time, Mr. Chair, mental health factors, where we have some of our folks that are experiencing homelessness that are violent or that are yelling at people, and part of why they might be resisting going into housing is because of the mental health aspect. So are your outreach workers trained in trying to deal with this, or do you partner with BCRI or some other entity?
We train my partners to provide the mental health and behavioral health services. They do go through specific trainings on that, but really to get the person the help that they need, we lean on our partners.
And the partners are?
We work typically with PEP and the service providers through BSHB. I think the challenge is being able to, and some people do need an emergency petition, but I think more work needs to happen within the continuum and working with the hospitals to ensure that if someone's discharged, that we can get them connected to the appropriate services.
We've definitely seen that happen where someone's emergency petitioned, they're taken to a hospital, analyzed, but then don't end up getting that second connection.
And that's a challenge for a lot of people in encampments too, especially if they're a danger to themselves or others. Like, we can do an emergency petition, but once we send them to the hospital, if the hospital says, oh, they're okay, they'll discharge them.
Right, without a shelter, without a house. And so that's something that we have to work on. I would just encourage that we also, I know BCRI is underfunded and we're trying to get them funded, but BCRI is a great resource for crisis response as well. And so I think, so you and I have talked about this hospital issue that we have to deal with, unfortunately. I appreciate that. Thank you, Mr. Chair.
Thank you. We've been joined by Councilman Ryan Dorsey, 3rd District, member of the committee. Councilman Torrance. And I'm going to ask colleagues, please keep questions brief, and agency, please keep responses brief.
Thank you, Mr. Chair. I just have 2 questions and a request. One is, how are we going to leverage federal dollars in terms of Medicare and Medicaid savings, especially since a number of persons in the populations that we want to serve actually qualify for it, and we can actually receive free money to actually help them. And then my second question is more broadly with youth homelessness. I've seen an uptick in the homeless rate in terms of city schools. When I was at city schools, the rate was around 3,000. They're now above 4,000 youth, and how we're coordinating with your office and city schools on that.
Sure. What was the first question again? I got the second one.
How are we going to leverage Medicaid and Medicare dollars?
Okay. Yes, so we're all for it. I think the ACES program, which I just spoke about, is a great example of cost savings to the community. We were approved by the state for a renewal for this year, and hopefully it's on we want to see it on a glide path to be Medicaid billable, which would create a cost savings just in general in terms of support services, but then a cost savings to hospitals because we have people connected to a primary care physician and utilizing that instead of an emergency department. So we're all for it. We will look at other ways of potentially using benefits to be able to support other programming like medical respite. In terms of the youth, we are working very closely with the schools. I know that they received an allocation of ARPA funding and have set some funding aside to support youth in schools that are experiencing homelessness and their families. We've been discussing ways to partner, and the first step that we're planning is really to do a mapping of families and youth within our system so we understand what services are going on and where we need to fill the gaps. So they're at the table. We want to make sure we're maximizing every resource that we have and are able to connect youth or young families to the appropriate housing and support services.
Perfect. And then my request, Mr. Chair, I sent the email on April 11th regarding the death that happened at the encampment downtown. I just want to know what SOPs do we have in place to prevent any other deaths while persons are...
A little closer, Councilman, a little closer.
I sent the email on April 11th regarding a death that happened downtown, asking for context and about our response. I have not received a response back from the agency yet. I just want to know where we are as a city coordinating. If a death does occur, what procedures we have in place to do wellness checks, but also do any preventative things that we can avoid them.
Director, I'm going to request a response in writing by call of business today on the Councilman's question. Is that reasonable?
Yes, that is.
Thank you very much. Okay. With that, we are now in recess. We will be back at 12:30 p.m. sharp for Charm TV, the excellent folks that are airing this whole production all week long. Thank you.